dear colleagues and dear guests. Today I have a pleasure to present our section Bioengineering in Oral Health, and my name is Svetlana Plamadeala, and I will present my colleague S6-1 that will present his topic. Please,
Thank you very much. Good morning, dear colleagues. My name is S6-1. I come from the Department of Oral and Maxillofacial Surgery and ICNBME of State Medical University of Medicine and Pharmacy Nicolae Testimisian. Today I will present my papers, which are assessment of anatomical balance in dentofacial anomalies using virtual surgical planning, and also assessment of anatomical balance alteration following automatic surgery based on FAB concept. So I will try to bring that today we are, so this conference brings that contemporary technologies together with creative thinking are the key for continuous development of medicine. We do not limit ourselves to what we already know, but we're forced to know something new, and this is a great opportunity for us to study something new every day. So what are dentofacial anomalies? Dentofacial anomalies are deformities or conditions which have different deviation from the normal of the development of the facial bone, jaws, as well as teeth. Orthodontic surgery may be defined as a surgical repositioning of the maxilla and mandible and their segments in order to improve the dental facial function and aesthetics. Also, it has a high impact on quality of life. The term orthodontic is derived from the Greek orthos, which means correct and straight, and gnathos, which is jaws. Indication for orthodontic surgery are a skeletal discrepancy severe enough, and also a desire for the patient to have orthodontic surgery in order to improve aesthetics and also function. Traditionally, in the treatment planning of these anomalies, specialists rely on clinical examination, patient photographs, but also two-dimensional radiography. Also, we use plaster study models mounted in an articulator and transferred using a phase valve. But these conventional methods have a drawback, especially because of the low precision. And also, Alice noted that these shortcomings can lead to significant errors and inaccuracies, both at the diagnostic stage as well as in the development of the treatment plan. Starting from these limitations of the conventional methods, more and more authors emphasize the importance of using the digital method of virtual surgical planning. 3D images can be obtained both from computed tomography and from STL surfaces of the files generated by optical scanners. In order to be able to digitally plan our surgery, we have to have a few things. First, we need a DICOM data, which is coming from either cone beam computer tomography or multi-slice computer tomography. Next, we have to take the surface data from our scanners. The second step is to do virtual surgical planning. For this, we need a software where we can superimpose the data from the DICOM and also the STL. Afterwards, we can manufacture our surgical planes, our anatomical models, which we can later use in our surgery. So, in order to start, we need a CT scan of our patient. The starting point was made by Hounsfield in the 1970s by using a CT in order to record the data about the anatomical situation of the patients. This is the image we had back in the days, and this is the image we are currently having. So, as we can see, a great progress has been made in order to get a high resolution of our data. In 1980s, advances were made by radiologists like Venier and his team by creating the first computed three-dimensional reconstruction from ACT dataset. In early 1990s, the surgical planning was performed using a stereolithographic model. Next, in 1990s, were the first time when we had a navigation system, and nowadays CAD/CAM technology are widely used during maxillofacial bone reconstruction to increase precision, optimizing aesthetic outcomes, and to reduce morbidity and operative time. 3D printing is a process by which a three-dimensional digital model is transformed into a physical object. The first printers were developed in 1980s, and the first 3D printing process was called stereolithography and was invented by Charles Hull. Nowadays we use scanners to get the optical data from either the dentures, or also we can use it for facial scanning. We have two options in order to get the dental models. We can scan intraorally, or we can scan it extraorally. Also, we are using nowadays facial scanners to optimize the diagnostics and treatment planning. Also, we have a few softwares that we can use. Some of them are with open license, and the other one you have to pay for the license. So, virtual surgical planning allows us to simulate different surgical techniques, and in the real time we can see the post-operative results. The success of surgical intervention largely depends on the surgical technique and the precise execution of the preoperative surgical plan. The virtual plan can be transferred into the operating room through a 3D printed anatomical models, surgical guides, and occlusal splints. Also, we can use 3D printed models that can be used also to assess the dentofacial anomaly, and it's easier even for the patient to understand what is the problem with his jaws. Also, using these models, we can pre-bend our plates, which will decrease the surgical time. Accuracy is also very important. That's why we should always superimpose our results with the planning to see what was the actual discrepancy. And in the literature, it is stated that we are allowed to have until 2 millimeters of deviation from our plan. Although modern technology presents a series of advantages, also specialists in the field still face difficulties in establishing the diagnosis, developing the treatment plan, and certain stages of surgical procedure itself, due to high polymorphism of dentomaxillary anomalies. At the same time, authors like Brody emphasize the importance of the town value. This is why it's very important to assess the anatomical balance. So, anatomical balance represents the ratio between town volume and oral cavity volume multiplied by 100, with the results expressed as a percentage. So, in case of this anatomical values, we should have correlation with dentomaxillary anomaly. So the aim of these papers is to determine the anatomical balance in patients with dental facial anomalies and evaluating postoperative changes for optimizing the surgical treatment through the application of virtual surgical planning. In the first study, we had 90 patients, which were divided by the malocclusion type. So we had 30 patients with class 1, which was the reference group, and 2 study groups, also with 30 patients in each, with class 1, with class 2 and class 3 malocclusion. So in the second study, where we assessed what were the alteration of the anatomical balance, we had 8 patients with class 2 and 12 patients with class 3. Inclusion criteria was the presence of developmental craniofacial anomalies, trauma in the lower facial region, temporal mandibular joint disorder, history of previous orthodontic treatment, and history of orthodontic intervention. Diagnostic methods used in the research, radiological imaging, which was cone beam computed tomography, direct and indirect scanning of dental arches and the face, and the last one was the three-dimensional volumetric analysis of the anatomical structures. Also, all of the cephalometric points were measured not only on the big-dimensional images, but also on the 3D images as well. Also, for each patient, we've segmented all of the anatomical structures that were needed for this assessment. So, how do we measure the oral cavity? Oral cavity is the sum of tongue volume, oropharynx volume, and free space of the oral cavity. So, for each patient, we've segmented the tongue, the oropharynx, the minimal area of the oropharynx, the free space of the oral cavity, distance between posterior nasal spine and hyoid bone, the distance from the hyoid bone to the menton, and this is how we assess the anatomical balance. In literature, we know that high anatomical balance is correlated with higher risks of obstructive sleep apnea, while low anatomical balance has lower risks of sleep apnea. The surgical procedure was done and the symmetry was assessed by the protocol described by Simonas Gribauskas. All of the procedures were done using intermediate and final splints. For anatomical models, we used a FDM printer, and for the splints, we used a resin-based DLP printer. All of the surgery was done at the Department of Oral Maxillofacial Surgery and Oral Implantology Arsenia Guțan. We started with the lower jaw first. In the lower jaw, we've performed the bilateral sagittal split osteotomy. As you can see in these images, these are images from the stages of the procedure. In the upper jaw, it was a 4-1 osteotomy, and in 5 cases we had multi-segmental 4-1 osteotomy. So, in order to perform an objective evaluation of volumetric changes before and after the surgery, we had to superimpose the pre-op with the post-op CT scan using a voxel-based superimposition, using the reference, the base of the skull. So T0 is the pre-op DICOM and T1 is the DICOM after 1 month after the surgery. Also, we assessed the changes of the oropharynx and the position of the hyoid bone. So, results of the first study. In this study, we've assessed 90 patients, which were divided into 3 groups based on their type of dental maxillary anomaly. Also, a total of 990 different anatomical structures were virtually segmented, including the facial skeleton, maxilla, mandible, hyoid bone, and so on. The tongue volume was almost the same for each class, so we don't see a difference in the tongue volume. The average oropharynx was also without any statistical differences. The average oral cavity volume was 99 centimeters cubic. Anatomical balance was also almost the same for each group. So the first hypothesis. Okay. The main research hypothesis assumes that the value of anatomical balance is dependent on the class of dental maxillary anomaly, which was rejected. In the second study, the alteration following the orthodontic surgery. So we've had 20 patients, in total of 34 orthodontic procedures. So, sorry, but it's not working properly. So the study was divided according to the time of which the segmentation of anatomical structures was performed. So again, before the surgery we had T0, and 1 month after the surgery, T1. Comparative evaluation of oral cavity and volumes at stage T1 and T0. You can find all of these graphs in the paper. I'm not going to overemphasize. But what I want to say is that anatomical balance, that both of the hypotheses were also rejected. Anatomical balance, which will change in the postoperative period, decreasing in class 2 and increasing in class 3. And also the null hypothesis assumes that anatomical balance will not undergo statistically significant changes in the postoperative period. I would like to finish with the general conclusion of both of the papers. So in orthodontic surgery practice, the incorporation of surgical planning technology should be considered in order to improve the precision and effectiveness of interventions. Specialists should be familiar with virtual segmentation techniques of medical images, as this can contribute to a more accurate evaluation of anatomical structures and pathologies. In patients with dentomaxillary anomalies, volumetric assessment of the oral cavity, tongue, and upper airway is recommended, along with the analysis of anatomical balance using the protocol described in this research. So let me do the. I'd like to finish with a thing that says nothing we can do can change the past, but everything we do can change the future. And with this, I would like to end and thank you for your kind attention.
Thank you. This is my presentation. Somebody have questions?
If there are any questions, I'm more than happy to ask. To answer.
So, next, I will present 2 topics, and if possible. So, dental caries is mediated by the bacterial biofilm, diet, and non-transmissible diseases resulting in the loss of minerals from dental hard tissue. The transition from oral health to caries diseases occur when a disturbance occurs that subsequently alters the condition in the oral cavity environment, favoring the development of a microbial community with enhanced acidogenic properties and more tolerant to acid action. At the same time, the ability to tolerate and produce acids cannot be attributed to a single living organism, but to a bacterial consortium interacting in a complex and which under certain conditions may increase its proportion or activity at the expense of other bacteria whose metabolism is less acidogenic. When environmental conditions change, the oral microbiome will also change and the effect can be reversible. Of the bacterial species identified in dental biofilms, Streptococcus mutans exhibits superior acid production capabilities, that resistance to acidic convertment and exopolysaccharide synthesis. Acidogenic and acidophilic bacteria gain a competitive advantage of these species by the intensive utilization of carbohydrates in acid production, mainly through phosphate-dependent pathway. As a result, the overall metabolic pathway of dental plaque is directly towards acid production, which leads to decrease in pH and consequently to a net loss of minerals from the dental structure. The salivary components maintain dental integrity, including antimicrobial proteins and buffering agents such as phosphates and carbonic acid bicarbonate buffers, as well as saline, H9, and urea. In addition, salivary mucins play an important role in maintaining the health of the oral cavity, may interact with the Streptococcus mutans by promoting their agglutination, which favors the decrease in the concentration of these bacteria. The same salivary secretory immunoglobulin A not only mediates the humoral immune response to regulate cavities activity, but also interferes with the formation of adhesion of carcinogenic microorganisms to the tooth surface and biofilm. Studies in recent years have shown that salivary immunoglobulin A plays an important role in local immunity by binding to surface molecules of carcinogenic microorganisms such as adhesion molecules to prevent their attachment to the surface of dental hard tissue. The objective for this study was to investigate the influence of the number of Streptococcus mutans on the level of immunity, the immune system biomarker in oral fluid in children for further development of highly accurate prediction methods for dental caries. Our prospective observational cohort study was clinical examined 398 children aged between 3 and 15 years. They was divided into groups, control groups that was with 266 cares-free children, and the research group that was 152 children affected with dental caries. It was carried out clinical examination of the children, estimation of Streptococcus mutans, count in oral fluid, and collection for tumor necrosis factor alpha, transforming growth factor beta 1, secretory immunoglobulin A, and antimicrobial peptide 27. The data collection was carried out by applying the instruments according to the questionnaire for recording the oral status proposed by World Health Organization, was assessed caries experience in disease prevalence indexed by dental caries, in temporary and permanent dentition. The prediction of the risk of occurrence dental caries was used kilogram software. The number of Streptococcus mutans in oral fluid was measured with salivary check mutants kit, and the data were processed automatically using the open source software. And the positive test result, the increased number of Streptococcus mutans in oral fluid was estimated at 75% of the children in the research group and 24% of subjects in the control group, which indicates an increased risk of developing caries lesion in the future. The low number of Streptococcus mutans in oral fluid was appreciated, and the patient does not present a risk of developing caries lesion in the future. The oral hygiene status of the children, including in their study, was assessed according to the dental plaque index green vermilion. The dental plaque index value in green vermilion children affected by dental caries was significantly higher comparing to the subject without caries. Thus, the state of oral hygiene for the children affected by dental caries was satisfactory, but for the children in the control group was a good oral hygiene. The level of immunoglobulin A, secretory immunoglobulin A in the oral fluid was significantly lower in children diagnosed with dental caries compared to the caries-free children. The statistically significant increase component of tumor necrosis factor alpha in the oral fluid was appreciated in the research group. Compared to control group, the oral fluid in children with caries lesion for the children with dental caries showed significantly reduced transforming growth factor beta 1 level compared to the caries-free children was more lower. Antimicrobial peptide 37 assessment in the oral fluid of dental caries affected children detected low value of the antimicrobial peptide and compared to the caries-free subjects, and the difference being statistically significant. In the oral fluid of children with caries lesion, significantly reduced transforming growth factor beta 1 level were found for the children affected by caries compared to the caries-free children. The results obtained in this study are in agreement with the results of research previously conducted by some authors. The authors view that the multifactorial cytokine transforming TGF beta 1 in one of the main regulators of the immune response and possesses potent anti-inflammatory properties and inhibits the production of other pro-inflammatory cytokines. The comparative study of immune system biomarkers showed a decrease in levels of salivary proteins factors in children with an increased number of Streptococcus mutans in oral fluid. Compared to the normal level of these biomarkers in subjects in the control group, the differences between groups being statistically significant. At the same time, the level of tumor necrosis factor alpha in oral fluid was higher for the control group, and that was significantly increased in children in group 1, which confirmed the immunity response to the increased number of Streptococcus mutans in oral fluid. Oral fluid is an attractive source for the identification of isolation of Streptococcus mutans because it can be easily collected non-invasively and allows the detection of several salivary biomarkers. To facilitate research and increase the accuracy of caries risk assessment, it is essential to use accessible and non-invasive but accurate methods to assess the number of this bacterium in dental biofilm and oral fluid. Although some works in the literature have found a positive correlation between the level of Streptococcus mutans and caries experience, other study has not identified clearly definite correlation between the two variables, which confirm the multifactorial nature of caries disease and suggest that focusing exclusively on the study of Streptococcus mutans as a reliable prediction of dental caries would underestimate the importance of interaction between other microbial communities in the pathogenesis of caries. And in conclusion, in children with the increased number of Streptococcus mutans in the oral fluid, statistical significance increased in the number of generalized area of tooth enamel, the level of damage by dental caries, and the risk of caries were detected compared to the subjects in the number of Streptococcus mutans in the oral fluid was assessed lower. The comparative study of immune system biomarkers showed a different level of salivary proteins factors and a significant increased level of other in children with an increased number of Streptococcus mutans in the oral fluid, and from high precision prediction of dental caries, the combined assessment of salivary biomarkers and the number of Streptococcus mutans in the oral fluid of dental biofilm is rational. So This is the end photo for our first topic, and I want to show how is the patient when they don't agree on treatment, and I think it's very actual to use this type of diagnosis and to make some measures prevention to don't have this phase when you are the dentist. And now if it's possible, second. Do it. The second topic is about the level of immunoregulatory molecules in vitamin D free in oral fluid in children with caries lesions. Dental caries, of course, is the most common oral health problem that affects a lot of the people. With the progress of science, dental caries is no longer considered an irreversible destructive process, but is reversible in certain clearly defined situations. The initiation of the demineralization process of tooth enamel and the subsequent development of caries lesion is influenced by a complex of etiological factors. The relative influence of each is not fully elucidated. Several authors support the concept that the caries process is formed as a result of the complex interaction of external and internal factors, among which an important role is played not only by dietary particularities, the presence of acidogenic bacteria, but also by disturbance in the local immune status. Numerous proteins present in saliva are involved in the local immune reaction, both innate and acquired. Resistance or susceptibility to dental caries correlated significantly with changes of oral fluid protein contents, which modulates in oral cavity microflora so that the protein composition of saliva is sensitive indicators of dental health and non-invasive biomarkers for predicting the risk of developing and progression of oral cavity pathology, including dental caries. The immune factors of saliva are largely presented by secretory hemoglobin A, which inhibits the process of bacterial adhesion to this tooth surface, neutralize certain enzymates, bacterial toxin-producing biochirogenic bacteria, and act synergistically with other cellular proteins, which may have effects of decreasing the risk. Vitamin D deficiency in one of the most overlooked and undiagnosed population health problem globally. Previous research has shown that it is imperative to address vitamin D deficiency and correlate it with systemic health problems. And vitamin D deficiency causes autoimmune diseases, infection diseases, cancers, skeletal manifestation, and depression. Research has also associated this vitamin deficiency with impaired mineralization of tooth enamel, as calcitriol is one of the main hormones regulating phosphoron calcium metabolism and ensuring mineralization of hard tissue of teeth. Other authors detected a moderate correlation between serum and saliva. Thus, vitamin D3 deficiency can be used as a marker for increased susceptibility to caries lesion and aggressive progression of dental caries. At the same time, the authors concluded that assessment of vitamin D levels in saliva could represent a non-invasive alternative to serum testing, especially in individuals with a low level of vitamin D intake. The same vitamin D plays an important role in innate immune responses by contributing to the differentiation and maturation of immune system cells and regulating the innate immune response by the production of the antimicrobial peptide calcidin in various concentrates in body fluid. The role of vitamin D in the metabolism of transforming growth factor beta-1 has also been described. The aim of this study is to estimate the relationship between vitamin D3 level and oral cavity immunity parameters, antimicrobial peptide 37 and transforming growth factor beta 1 in oral fluid in children with dental caries for further development of non-invasive method for prediction of dental caries. The same study, the same number of children also was divided. What I forget to tell in the previous research, it is the ages of this patient was 3, 6, 12 and 15 years. The same was two groups because it's very important to have research groups with dental of caries affected children, and the control group too can compare the results. The same material and methods you used, exception what was here. After 1 year, we performed a repeated clinical examination to verify the ability of the dental cares prediction, estimating of cares experience indexes. The results of cares experience indices for research group value, because just for research group you have this value, we have information about the number of the tooth, and the other value is for the surface of the tooth, that of course is more bigger. And comparing with the control group, it's 0. This is the reason why I don't show here. The complex and personalized prediction of dental caries using the Cariogram software highlighted moderate caries risk in children with caries lesion, the chances of avoiding new caries cavity being 53%. In caries-free children, of the chances of avoiding the new caries cavity was 82%, the caries risk being low. A significant differences was detected between the groups of children using the Wilcon ransom test. And here is the result of all the biomarkers. First, it's caries group, the children that was affected with the caries, and the second is the results comparing with the person that is caries-free. And human saliva contains several immunoglobulins which account for approximately 50% of total salivary proteins. Secretory immunoglobulin A plays an essential role in inactivating bacterial products, prevent bacterial attachment, and forms a protective layer of the surface of the oral mucosa. It has previously been demonstrated that antimicrobial peptide cathelicidin prevents biofilm formation of the tooth surface, inhibits the growth and colonization of Streptococcus mutans, decreased the thickness of existing biofilm and the adhesion of microorganisms to the tooth surface, thus reducing the production of inflammatory markers, and has the potential to increase the antimicrobial capacity of anti-inflammatory cells such as neutrophils. The correlation analysis performed in the present study related directly links between the content of vitamin D in oral fluid and the level of cathelicidin peptide. The level of secretory immunoglobulin A and transforming growth factor beta 1 in subjects affected by dental caries. At the same time, similar correlations were not observed in the control group. This fact can be explained by the production of protective peptides as a result of the binding of the activity form. Correlation analysis detected an inverse relationship between the rate of progression of new caries lesion and the level of salivary biomarker study. Transforming factor beta 1 and cathelicidin. Thus, the analysis of the results of the present study detect significantly low level of vitamin D in children with caries lesions. We believe that vitamin D deficiency was followed by a decrease in the level of immunoregulatory proteins of the oral fluid, which caused rapidly aggressive evolution of the CARES process in children of different ages. At the same time, the level of vitamin D in the oral fluid estimated in children from the control group highlights the effects of vitamin D in predicting dental caries, including due to this antibacterial role by influencing the production of immunoregulatory molecules. And in conclusion, in these caries receptive children, direct links were found between the oral fluid contents of vitamin D and the level of caseolycidin peptide, secretory immunoglobulin A, and TGF beta 1. However, similar correlation were not observed in the control group. Correlational analysis detected an inverse relationship between the rate of progression of new caries lesion and the level of the studied salivary biomarkers. They combined assessment of these biomarkers for oral fluid represent a non-invasive and innovative analysis for the prognosis of dental caries, with higher sensitivity and sensitivity to the identification of subjects at high risk of rapid aggressive evolution of the caries process. At the same time, for the clinical use of oral fluid biomarkers, it is necessary to develop standard protocols and conduct extensive studies in which the influence of various confounding values is excluded. And the other photo is for happy children, and you think that the future smile of our patients, our young relatives to be like this, because if you are relaxing, your life is very happy. So thank you for your attention. Yes. We can continue with also our colleagues of our department, and I have a pleasure to introduce my colleague, dear Svetlana. Please, you will present us two topics.
Good morning, dear colleagues. Let's apologize about my voice. I'm very glad to be here in front of you. My name is Elena Christian. I'm a university assistant in the P1 Department of Oral and Maxillofacial Surgery and Periodontics. At our department, our team have done studies on the preterm birth with children. And here I have present for you. I will present the results of the two studies. First of all, the structural and chemical peculiarities of the two terminal and premature birth children. This study was done on children from 1 until 15 years old. So let's start. The World Health Organization defined like preterm birth as any birth before 47 completed weeks of gestation, or less than 2 159 days from the first day of the woman's last menstrual cycle, with a birth weight of less than 2.5 kilograms. According to a global study, approximately 15 million of premature births occurs each year. So that is 85% of all births. This 85% takes place between 32 and 37 weeks of gestation, and the rate is increasing in almost all these countries. In the Republic of Moldova, the more than 1,700 children are born prematurely each year. According to our statistics, it's about 5% of all births in the Republic of Moldova are prematurely. Due to the growth and the development disorders, nutritional deficiency and malnutrition, and multisystemic disease, premature and low birth weight children are significantly more susceptible to functional disorder across all organ systems, including the somatic nervous system. Premature birth and low birth weight can contribute to the development of dental maxillary stomatognatic system disorder, as well as severe dental problems such as hypomineralization or hypoplasia in both dentition in primary and in permanent. Other studies have found that prematurely born children are more prone to develop dental caries at early ages due to impaired growth of the development of the primary dentition, difficulties in maintaining oral hygiene, and defects in enamel mineralization. The last trimester of the pregnancy is essential for the optimal incorporation of the minerals into the enamel matrix of primary teeth. As a result, the enamel of prematurely born children tends to be more porous and less resistant to the oral environment. Enamel hypoplasia is more frequently observed in primary incisor, often presenting as a semi-lunar sectioning of the incisal edge. The root surface of hypoplastic enamel facilitates bacterial plaque formation and promotes the adhesion of the Streptococcus mutans, which can lead to a rapid progression of caries in primary teeth. For the rationale of effective implementation of the dental caries prevention method to individual risk factor, it is essential to identify the structural and chemical peculiarities of the tooth enamel in prematurely born children, which remain in species study until now. To achieve the aim of the study, a case-controlled clinical study was conducted to assess the impact of the calcium metabolism disorders on the susceptibility to dental caries in prematurely born children. Salivary biomarkers of calcium homeostasis were analyzed in a sample of 978 children aged between 1 and 15 years. The sample was divided in two proportional structured groups. The research group including 326 children born prematurely, while the control group was consistent by 652 conventional healthy children. The distribution of children in groups was proportional according to the age, gender, and living environment. Among the prematurely born children examined, boys predominate comparative to girls. Boys was 57.6%, girls was 42.3%. Children from the rural area also predominate, 53.9%, comparative to those from the urban areas, 46.0%. These findings are consistent with statistical data indicating a higher frequency of the premature birth among the boys in rural areas in the Republic of Moldova. The degrees of the prematurity in children included in this study was assessed based on anamnesis data, specifically according to the gestational age. Near-term premature birth was gestational age between 34 and 36 weeks and was reported in 30.9% of the children. Moderate prematurity, gestational age between 32 and 33 weeks, was defined in 30.9% of subjects. Severe prematurity, gestational age between 28 until 31 weeks, was observed in 31.9%, and while extremely premature gestational age was from age of 20 to 27 weeks, was reported in 6.1% of the children. The structure and the chemical composition of the various region of the dental enamel was analyzed in 28 children, 12 from the source group and 16 from the control group. Ages was between 12 and 50 years. The research was focused on animal samples prepared from the teeth extraction for medical reason. We have done scanning electron microscopy, radiospectral microanalysis using energy dispersive X-ray spectroscopy and material detection, and anatomic force microscopy. So how we see in this table, this was how we have divided our groups and how many number of samples we have done for each group. That is good. The analysis of the results assessed the level of morbidity due to the dental caries leave the gap between the caries experiences indicating prematurely born and conventional healthy children. The value of the dental caries prevalence index in prematurely born children was 65.0%, that is was with 22.7 high comparative to the conventional healthy children. Following to the electronical optical study, microcracks, protuberance, and other microstructures such as holes leading into a microcanalicle up to 2 microns in diameter were observed on the surface of the tooth animal, forming a characteristic honeycomb pattern. On the fracture surface of the animal, tunnel shapes microcanal were also observed, penetrating into the deeper layers of the animal and altering the orientation of the animal breath. In prematurely born children, unlike conventional healthy ones, the surface of the tooth animal was characterized by eczema with numerous pores and disorganized structured elements. The microcanalicle observed on the fracture surface of the animal were poorly defined. Some appears deformed and exhibition on sinusoid shape. Here you can see in this figure from in the left side is in the healthy children, from the right side is in the premature born children. Analysis of three-dimensional imaging obtained using the atomic force microanalysis technique relieved a root and in the teeth extracted from the prematurely born children, characterized by numerous pores ranging from 4.3 to 7 microns in diameter. It's constant the animal of conventional healthy children exhibition a lower degree of the surface roughness, with pores depth ranging from 0.1 to 2.1 microns. Here we can see the three-dimensional imaging in premature born children. And here you can see three-dimensional images in the healthy child. Radiospectral analysis relevance and increasing concentration of the carbons and the presence of the nitrogen, the main elements of organic components within the opening of the animal microcanalicle in intact teeth. In constant this opening, no nitrogen was detected on the surface of the hydroxyapatite crystals, where the concentration of the calcium, potassium, oxygen, chlorine, and sodium were elevated. The superficial layer of the animal were more saturated with minerals substance comparative to the deep layers. In the hydroxyapatite crystals of the superficial animal layers in the teeth extracted from the premature born children, a low mass percentage of phosphorus, chlorine, magnesium, and sodium was detected comparative to teeth extraction from the healthy children. In constant, the mass percentage concentration of the carbons and oxygen was significantly increased in comparative to teeth extraction from the healthy children. This difference is the composition of the mineral fraction of the teeth of healthy children and premature born children are due to the disturbance in the formation and mineralization of the dental hard tissue. Here you can see the difference between, in this table you can see the difference between the content of macro and micro elements in the superficial layers of intact tooth element in prematurely born children and healthy children. When scanning the surface of the animal affected by incipient caries in the areas of microcanalicular opening and increasing in the mass percentage concentration of the carbons, silicones, chlorine, and nitrogen along with reducing in the mass concentration of the phosphorus, calcium, and zinc, was observed. Unlikely intact animal areas affected by carriers showed the presence of the potassium in the microcanalical opening. On the surface of the hydroxyapatite crystals, the mass concentration of the carbon, silicones, and magnesium were found to be increasing, while the concentration of the sodium, phosphorus, chlorine, and zinc and silicones were reducing comparative to intact animal. When scanning the longitudinal fracture surface of the carrier's animal, a demineralization zone was detected beneath the superficial layer of the unaffected animal. This zone, which was a triangular shape with its base orientated toward the animal's surface, showed a significant reduced mass percentage of the phosphorus, calcium, chlorine, sodium, magnesium, fluor, zinc, and silicon, conservative to the concentration of carbon, oxygen, sulfurs, and potassium were increasing. These changes can be explained by the destruction and dissolution of the mineral components of the hydroxyapatite crystals within the demineralization zone, along with an increasing land permeability of the superficial animal line. In the region that separates the demineralization zone from the unaffected animal, the mass percentage concentration of carbon and nitrogen were reduced, likely due to the loss of the organic components from the interplasmatic space. Additionally, the mass percentage concentration of the chlorine decreased, while the oxygen increased, indicate the onset of the demineralization and disorganization process. The mass percentage concentration of the of the calcium and phosphorus remain unchangeable. This is in this table you can see the macro and micro elements of surface layer in carriers dental, in animal with starting carriers lesion. Research on the mass percentage concentration of the chemical elements in the animal of intact teeth and those affected by caries has relevated that an area of the caries precedes the concentration of the carbons, phosphorus, calcium, chlorine, and other lesser extent oxygen and natrium are significantly altered. At the onset of the dental caries, the mass percentage of the carbon increases by 1.6 times, sulfur by 4.1 times, and chlorine by 1.5 times. Simultaneously, there was a significant increase in the mass of the potassium of kalium to 0.4 of the total amount of the chemical elements, while the mass of percentage of oxygen decreased by 2.2 and natrium by 1.2 times, calcium by 1.3 times in the opening of the animal canaliculum. In the animal demineralization zone, significant losses in the mass percentage of the mineral compounds were observed. Phosphorus by 23.5 times, calcium by 16.2 times, chlorine by 1.6 times, natrium by 1.4 times, magnesium by 2 times, fluor by 1.4 times, zinc by 1.8 times, and silicon by 1.9 times. In contrast, the mass percentage of the carbon increased by 2.3 times, oxygen by 1.7 times, and sulfur by 7 times, indicating destruction and loss of the mineral components of the hydroxyapatites in the affected area. In the area delimited the demineralization focus from the intact animal, the mass percentage of the carbon were reduced by 4.4 times, nitrogen by 20 times, calcium by 1.3 times, phosphorus by 1.1 times, chlorine by 2.9 times, while the mass percentage of oxygen increasing by 2.6 times. This study found that the electron-optical structure of the animal surface in prematurely born children is characterized by areas with an abundance of fluorescent microcuts. Additional and statistical significant increase in the organic components of dental element, along with a significant reduction in the concentration of the mineral substance, was observed compared to the mineral composition of the animal in the teeth of practically healthy children. The results of study are consistent with significant report by several authors, which highlight a significant reduction of the mass percentage of the mineral compounds in demineralization animal, accompanied by the increasing of the mass percentage of the carbon and oxygen, as well as considered as a risk in the mass percentage of calcium during the initial stages of the caries process. In the zone delineating the demineralization focus from the intact animal, in addition to the decrease of the mineral compound content and the increasing of the mass percentage of the oxygen, a reduction in the amount of the organic content was also reported. Total protein decreased by 1.5 times. Biopolymers, cationic proteins, and neutral glycoproteins by 1.9 times, and hyaluronic acid by 2.4 times. These changes are attributed to the dissolution of the components of the tissue barrier by the metabolic products of the microorganism involved in the initial stage of the animal demineralization. Research into the mass percentage composition of the chemical elements in the animal of intact teeth has revealed a significant decrease in the concentration of the calcium, phosphorus, and sodium ions, and an increasing of the levels of the carbon, sulfur, and silicon ions in prematurely born children, comparative to conventional capsule. It can be assumed that this difference is the composition of the mineral fracture of the dental animal in premature born children are due to disturbance in the formation of the mineralization of dental hard tissue. The increasing proportion of the organic components of dental animal relative to the mineral components significantly reduce its resistance to dental caries. Although there are relatively few studies focuses on structural and chemical characteristics of dental animal in children with severe developmental disorders of various etiological compared to healthy children. Our results are consistent with those with Alzheimer's and others who reported that prematurely increases the risk of animal defects by factors of 4.3. A possible explanation for the high prevalence of the animal defects among the premature children may be related to the chemical and microscopic characteristics of their dental hard tissue. It has been found that the animal of primary teeth in premature children show an increasing frequency of mineralization disorders as detected by scanning electron microscopy analysis. Research conducted by Ritten and others established that prematurely born children with very low birth weight experience a multiply neonatal and postnatal complications that can affect the process of the tooth mineralization. The authors report significant difference in the chemical composition of dental animal in premature children compared to the control group, characterized by a high relative concentration of the carbon, lower relative concentration of calcium, reducing the calcium-phosphate ratio, and low calcium carbon ratio in external animal line, indicating an increasing porosity. One of the most important mechanisms involved in the initiation of the dental caries might be the disruption of the mineralization process of dental hard tissue due to the disturbance in calcium homeostasis. The deficiency of the vitamin D3 observed in premature children appeared to trigger disruption in mineral and bone metabolism, as described by several researchers. According to the study of Bioengineering and others, the best known function of vitamin D3 is to maintain the calcium and phosphorus homeostasis in the body and to support the bone mineralization. In the study, the scanning electron microscopy, the radiospectral microanalysis, anatomic force microscopy analyze relief the following structural and chemical peculiarities of dental animal in prematurely born children. An increasing proportion of the organic components relative to the mineral components, the percentage area with abundant porosity and disorganization of structural elements of the animal surface, decreasing mass percent of the next minerals, and absence of the well-defined microcanonical contours on animal fracture surface with some appearing deformance and sinusoidal shapes. The structural peculiarities of animal observed at both the molecular and macroscopic levels in prematurely born children may be attributed to the disturbance in the tooth formation and or mineralization occurring during the pre-eruptive development period, as well as during the post-eruptive mineralization stages. This disturbance may result from development delays, immune system dysfunction, hormonal imbalance, and dysregular or phosphocalcium metabolism. So, in conclusion, the scanning electron microscopy, the radiospectral microanalysis, anatomical force microscopy revealed the following structural and chemical peculiarities of dental animal in prematurely born children: an increasing proportion of the organic components relative to the mineral compounds, the presence of area with abundant porosity and disorganization of structural elements on the animal surface. The structural peculiarities of animal identified at both the molecular and macroscopic level in prematurely born children suggest an increasing risk of development of dental caries and highlight the need for effective preventive measures addressing to this group of risk in prematurely children. Yes, thank you a lot for being with me. The next study, we have done another study on the same week, was with oral fluid microcrystallization, and let me present the results. The oral fluid. So with the same children with hepatocytization potential of the oral fluid, biological fluid directly reflects the body homeostasis and respond dynamically to the both physiological and pathological changes. In line with the principle evidence-based medicine, it is essential to employ clinical and paraclinical research methods capable of providing highly precise quantitative parameters. These are crucial for the scientific validation and selection of therapeutic strategies in the investigated pathologies. Unlike standard biochemical tests which quantify the concentration of the specific substance, morphological analysis enable to visualization of the microstructural organization of these fluids in correlation with their biological functions. Morphological research of the biological fluids offers valuable perspective in the diagnosis and prognosis of various diseases. It represents a multidisciplinary field that integrates knowledge from the cell biology, colloidal chemistry, laboratory medicine, and advanced imaging. The crystallographic study of saliva currently reflects the therapy status of the oral cavity. This method evaluates the facies macrostructure of the biological fluid it forms during its phase transition from the liquid to solid state. Oral fluid played a crucial role in maintaining of the physiological balance between the process of mineralization and demineralization of tooth animal, particularly during childhood. The micellar structure of the saliva also facilitates activate ion exchange between the tooth enamel and oral fluid, helping to maintain the mineralization potential of the environment in an optimal state. The analysis of the literature suggests that the morphological study of the biological fluid, the special oral fluid, offer a non-invasive, rapid and sensitive alternative of the assessing oral and general health status, including the prediction of the dental caries. Preterm children are more susceptible to defects and disorders in tooth enamel mineralization, as well as to an increasing risk of developing of dental caries. The prolonged period of dental organ formation increasing the likelihood of the influence of various etiological factors, hereditary, congenital, and acquired. In this context, the study of oral fluid crystallization peculiarities acquires particular significance as it reflects the state of the mineral balance between tooth enamel and oral environment. This approach shows promise for use in the personalized prediction of dental caries in preterm children. The purpose of the study is to elucidate the crystallization potential of the oral fluid in pretermly born children. To achieve the aim of this research, a case-controlled clinical study was conducted to identify the morphological characteristics of the oral fluid in the preterm children. The oral fluid crystallization potential was analyzed in a sample of 178 children, aged from 1 to 50 years, divided in two groups proportionally. This research group was 326 preterm born children, and the control group is 652 conventional healthy children. The inclusion criteria were for age between 1 and 15 preterm children, according to the Ministry informed consent obtained from the parents of legal representatives of the child participating in the study, and exclusion was lack of the informed consent. The degree and the healthy children, yes. The degree of the premature children included in the study, I have said about this in previous paper. So the level of the dental caries damage was assessed by estimating the prevalence of the prevalence index of dental caries. The dehydration of the saliva droplets was performed in the unit at 37 degrees, protected from dust. Micro preparation were examined using an Amscope B120CE1 binocular compound microscope. The central of the peripheral areas of the saliva fascias were investigated using oral fluid crystallography. Fractal structures, separated crystals, and amorphous substance were analyzed. The interpretation of the crystalloscopic compounds were carried out by applying special tables that outline the characteristics of the study structure. For the quantification of the oral fluid microcrystals, the oral fluid microcrystallography analyzed algorithm was applied. According to this algorithm, the preparation was examined to highlight the layers of the oral fluid basis. The micro preparation was examined. The oral fluid crystallization potential was evaluated after examining the dried oral fluid droplets, with the result expressing immune points based on the identified types of crystal formation. For example, 0 from 1.0 very low, from 1.1 until 2 low, from 2.1 to 3 satisfactory, from 3.1 to 4 high, and from 4.1 until 5 very high. The study was conducted in accordance with the principle of Declaration of Helsinki, approved by Research Ethics Committee of Newcastle State University of Medicine and Pharmacy. To analyze the investigation results, the advice was created using the Microsoft Excel spreadsheet program, into which information from the child's clinical observation sheets was entered. Data analysis was performed using Microsoft Excel and EPE47 software, along with their functions and models. The analysis of the results regarding The assessment of dental caries morbidity highlighted a significant gap between caries experience indication in pattern 2, and we said about this in the previous presentation paper, that is the prevalence indices in pattern children is high with 22.7% comparative to the healthy. In pattern children, we have found that the prevalence is 65.0%. In accordance with the concept of classification of crystallography, the present study applied the crystallographic research method to the most accessible biological liquid, oral fluid. The peculiarities of oral fluid crystallographic potential in preterm children were examined in comparison with conventional healthy children. Following to the dehydration of the oral fluid droplets on the glass slide, a sediment was observed, the microcrystalline structure of which was found to depend on the health of the oral cavity. Both the central and peripheral zone of the oral fluid phases were analyzed. We have found 5 types. Type 1 oral fluid microcrystallization is characterized by presence of the large prismatic crystalline structure fused together into a tree-like pattern, resembling an affair. For objective quantification of the data, this type of microcrystallization was assigned 5 points. Type 2 is features randomly fused fractal structure lacking clear organization and was assigned a score of 4. In type 3, the central area of oral fluid bases dominate but isolated star-shaped crystal, while large fractal structure persists in the peripheral areas. This type was assigned to score 3. Type 4 is characterized by individual crystal shaped like branches or roots relatively uniformly distributed across the entire surface of the dehydrated droplets and was assigned by 2. And type 5 is marked by an abundance of separated crystals with various shapes, sterile, oval, regular, distributed, isometrical. This type was assigned 1 point. Microcrystallization of the oral fluid refers to its ability to form crystalline structure following to the controlled dehydration process. The application of the crystallographic research methods allowed for a detailed analysis not only of fractal structure and isolated crystal, but also of the amorphous substance of dehydrated fluid oral droplets. The comparative studies of oral fluid crystallization potential revealed the types 1 and 2 of oral fluid microcrystals predominant in conventional healthy children. Types 1 and 2 of oral fluid microcrystals are considered to be associated with a high potential of oral fluid mineralization and increasing the resistance to action of carcinogenic factors. In healthy children, the oral fluid crystallogenic potential is caused by the predomination of the prismatic and cruciform structure in the peripheral areas and indicate of oral fluid with an increasing mineralization potential. In contrast, in preterm children, the types 4 and 5 was detected were predominant, which are specific to an increasing intensity of the caries or an evaluated risk of dental caries. Type 1 and 2 of oral fluid microcrystallize were identified in only 27 and 3% group in research group. In children from the research group, significant changes in the crystalline architecture were detected, reflected by disorganized arrangement of the cruciform crystals of various sizes diffusely distributed across the entire surface of dehydrated oral fluid phases. The peripheral area had a considerably expanded appearances with signs of structural alteration, suggesting an imbalance of mineral substance in the oral fluid. Quantification of the oral fluid microcrystal using the oral fluid crystallography analysis algorithm revealed that the oral fluid crystallization potential in preterm children was low, with a value of 1.8 in contrast with the high crystallization potential observed in conventional health subject that was 3.6. However, the oral fluid crystallization potential in preterm children was 1.9 times lower than estimated in healthy children. Changes in the morphological pattern of oral fluid resulting from the microcrystallization properties serve as indicator both qualitative and quantitative disorders of the saliva proteins, particularly mucins, and represent one of the earliest markers of pathological process in the body. The changes can be used to detect diseases at the primordial stages, enable to effective implementation of preventive measures and minimize invasive treatment. Disturbance in the microcrystallization of the oral fluid reflects quantitative and qualitative alteration in the composition of the mucin, which are associated with increasing risk of carious lesion development. Disturbance in the microalization process of oral fluid reflects significant quantitative and qualitative change of mucin composition, constitute an important etiological factor in increasing of dental caries. The demineralization of the two phenomena during the carious process affect the properties of saliva, leading to alteration of the crystalline structure of the oral fluid. The degree of oral fluid microcrystallization in children is directly correlated with both the duration and activity of the carious process. The identification of specific criteria for crystallographic changes in oral fluid caused by the systematic functional and metabolic imbalance significantly enhance the accuracy of diagnosis and prediction of dental caries. The dehydration methods provide a valuable overview of the overall health status of the body. Alteration in the shape, size, and arrangement of the crystal directly reflect changes in the physical-chemical properties of oral fluids, such as pH, proteins, concentration, buffer capacity, and redox potential. A detailing analysis of morphological features of the oral fluid emerges as a reliable predictive test for identifying dysfunction in the protective mechanism of oral cavity. The major advantage of these methods is accessibility, procedural simplicity, low cost, and non-invasive nature, make it suitable for integration into the routine of dental practice, including in pediatric population screening. The oral fluid crystallogenesis research methods can be applied not only in diagnosis and predictions of oral cavity disease, but also as sensitive indication of overall organized function. These methods contribute to development of highly informative, non-invasive approach for diagnosis comorbid condition and for timely detection of the changes in the health status of the population. So, in conclusion, in preterm children, the crystallization potential of oral fluid was found to be 1.94 times lower comparatively than healthy full-term subjects, full-term children. The decrease in oral fluid crystallization potential is a significant etiological factor contributing to increasing susceptibility to dental caries, especially during the post-eruptive tooth mineralization period. The identification of the crystallographic features through the oral fluid crystallographic process potential assessment method provides a complementary diagnostic and predictive tool for dental caries of very practical clinical value. It all allows for the identification of the individual susceptibility to dental caries, offering the opportunity to select effective, personalized, and early methods of dental caries prevention. Thank you a lot. Thank
you too. So next, it's the topic aesthetic perception of dental fluorosis and quality of life in oral health, and we present our colleagues in the microphone.
Distinguished guests and colleagues, I'm really happy to be here you today and to put in the discussion I have prepared. Today I will speak about the aesthetic perception of dental fluorosis and quality of life related to oral health and I will begin with the introduction. For the beginning, I want to say that dental fluorosis is a condition that changes the normal appearance of the tooth enamel, its translucency, color, and structure surface. It is severity depends on different factors such as the duration and type of the fluoride exposure, the body weight, the physical activity, nutrition, bone development, and metabolism. The severe dental fluorosis is not only a compromised dental function and aesthetic, but affects also the quality of life, lead to psychological distress, reduces self-estimate and social avoidance, particularly among children and adolescents. The materials and the methods in this research, it is the narrative literature review, and we have the scope to summarize findings about dental fluorosis, its causes, implications, and management. Specifically, we have taken 46 sources from different ages, beginning with 1994 to 2022. All selected studies were either written in English or translated to English to ensure the accessibility of the information. In the review, we included articles, reports, books, conference papers. We all have taken them from PubMed, NCBI, and Google Scholar. Some of the most important keywords we included was oral health, quality of life, dental fluorosis, aesthetics, and fluoride. All sources were screened, evaluated, and critically appraised. Research that we have taken includes different types of studies, beginning with the descriptive studies, analytical, observational, and experimental studies. The descriptive studies describe the distribution prevalence of dental fluorosis in the population. They are almost cross-sectional or longitudinal. Analytical one are cause-effective studies. They have the aim to identify a relationship between fluoride exposure and dental fluorosis. The observational studies, these are the cohort and the case control studies. They have the aim to observe the population and identify the possible risk factors associated with dental fluorosis. And the last one are the experimental one. Studies involve the population and measures to impact the intervention of the development of dental fluorosis. Some of the techniques used to find the field of dental fluorosis research include the clinical examination, questionnaires, environment assessment, the educational interventions. In the clinical examination, dentists or trained examiners visually assess the severity and extent the dental fluorosis in the population. In the questionnaires, participants are asked to fill out a paper to collect the information about the fluoride exposure, dietary, their habits, oral hygiene, and other relevant factors. The environmental assessment, the level of fluoride in the water supply, air, soil, and the other environmental factors are measured to determine the existence of fluoride exposure in the population, and the educational interventions provide information. In these studies, the technical are used to improve the understanding of dental fluorosis, its causes, possible interventions to prevent it. Some clinical features. Here we present the normal appearance of a tooth, the mild, the moderate, and the severe forms. The early fluorosis presents a fine horizontal lines that are called perikymata, corresponding to striae of radius. All fluoride exposure increases, enamel become more white and more opaque. In moderate forms, there are more than 50% of the enamel is affected with adhesion and staining, and the severe cases show extensive pitting, brown and yellow straightening, enamel fragility, and they also can be post-eruptive fractures. The changes compromise both function and aesthetics, increasing susceptibility to the decay. Dental fluorosis was first observed in a collaborative study between Frederick McKay and Green Verminian Black in 1909 in the people in Colorado, where the scientists were very fascinated by the things that they have found. It was never mentioned in literature before, and they describe it as an endemic imperfection of the enamel of the teeth. Further investigations have shown a direct link between dental fluorosis and the exposure of fluoride through the environment. Geographically known fluoride belts on the land, including one of the strangers from Syria, through Jordan, Sudan, Kenya, Egypt, Liberia, Algeria, and other states like Turkey, Iraq, Iran, Afghanistan, India, North Thailand, and China. There are similar situations in the America and Japan. Another author, William, in 2006 included 90 volunteers that were participants. Their age range was from 18 to 66, and the methodology was that the volunteers reviewed intraoral and extraoral images of dental fluorosis. The focus of the study was to understand how people perceive the aesthetic impact of dental fluorosis and its effects on the quality of the life. The recent work by Podgorski and Berg from 2022 used machine learning to analyze soil, geological and climate data. The global map shows a large part of Africa and Asia exceeding fluoride with potentially dangerous levels of exposure. This research helps estimate population at risk and provides preventive measures. A total of 27 countries adopted fluoridation policies, including the United States, Canada, Brazil, China, Argentina, Spain, Israel, Austria, and others. And it is supported by the World Health Organization and the World Dental Federation and the International Association of Dental Research as a safe and effective means of reducing tooth decay and control over dental fluorosis. The optimal fluoride intake is considered to be 0.05 to 0.07 milligram of fluor per kilogram body weight. When this balance is exceeded, dental fluorosis may appear, producing aesthetic and functional changes. The condition is not only clinical but also a cosmetic concern affecting patients' self-estimate and social appearance. It conditionally strongly impacts oral health, related quality of the life, social rejection, and ridicule often follows deviation from the normal of a beautiful smile. Quality of life measurement tools have been developed to capture these psychological impacts, emphasizing the importance of prevention and management. The impact on the children. Varnish in 2022 studied children from 12 to 15 years old in an endemic region of Iran. These children were with severe fluorosis reported significantly low quality of life. Daily performance most affected was including like eating, speaking clearly, teeth cleaning, smiling, confidence, and socializing. Emotional control and school activities were also compromised. The dental fluorosis appears when fluoride intake during the formation of the teeth exceed the safe level. It represents a major aesthetic problem worldwide as well as a psychological burn. Research has documented the rising prevalence of fluorosis in multiple populations. For example, the severe recording has increased from 22% from 1986 to 41% from 1999 to 2004 and 65% in 2011-2012. This rapid increase highlights the need of ongoing preventive policies and improved management strategies. The oral health various questionnaires measures oral health impacts on life Here we have presented the positive trends, the negative trends, and the neutral ones. The oral impact on daily performance measured to extent which a person performs on daily activities may be compromised by the oral health. It includes 3 levels. In first level we have oral status, which includes an oral impairment. In level 2 we have the intermediate impacts, such as negative impacts on oral status. And in level 3 they evaluate psychological, social and psychological, physical performance. It measures pain, discomfort, function, limitation and appearance. The final scale consists of 8 performances which are scored from 0 to 5, and its importance it is noticed in the questionnaire that can be influenced by factors such as culture, language and the individual differences. And from the last but not the least important, we want to speak about the parental influence. Romania studies on 814 school children, which include 388 boys and 426 girls aged from 11 to 14 years. With the parental education reduces fluorosis risk and improves oral health. However, discrepancies existed between parents and children perceptions. Parents may overestimate or underestimate the children's quality of life. Children focus on immediate daily difficulties while parents worry about long-term outcomes. And this gap complicates assessment of true impact. For the conclusion, I want to say that fluorosis varies in prevalence depending on geographical and fluoride intake. While some argue fluoride exposure is an individual responsibility, others emphasize the government's role in regulation of water and product safety. Most affected are children in rural and low-income areas. Preventive programs including fluoridation and milk, salt, water fluoridation is impractical, but play also a key role. Educational efforts remain the cornerstone of reducing fluorosis impact, especially in vulnerable populations. Thank you, everyone.
One more presentation for this section. It is healthy diet of the preventive factors for dental care in children across the European Union, and will present Dr. Maria Magdalena. No, student. Student, Alexandra.
Good morning, my name is Turek Rahoveanu. I'm a fourth-year student at University of Medicine and Pharmacy Magdalena, Bucharest. And today I will present you the paper Healthy Diet as a Preventive Factor for Dental Caries in Children across the European Union. First I will start with the abstract, investigating the link between healthy eating habits, prevention of dental caries in children in the European Union context, methodology, comparative analysis based on Eurostat statistical data, national reports, indicators analyzed the prevalence of dental caries, nutritional policies, educational intervention, and access to dental services. And case studies, good practices, Romania, and Sweden, France, Germany, Spain, in school curricula, fiscal regulations, and health-oriented taxes, and community initiatives. The main results, the need for integrated public policies, nutritional education, health taxation, free access to dental services, and active involvement of local authorities, and Romania's situation, potential for improvement by expanding existing programs, creating a coherent legislative framework. The introduction, purpose to analyze the role of healthy eating in preventing dental caries in children, focusing on the policies and initiatives implemented in various member states of the European Union. to identify best practices that can be extrapolated in other national contexts in order to harmonize prevention strategies at the European level. A series of chronic conditions share similar risk factors, mainly unhealthy diet, excessive sugar consumption, low level of health education, and sedentary lifestyle. Systematic studies show a dose-effect relationship between the amount and the frequency of sugar consumption and the occurrence of caries. And the policy measures such as the promotion of healthy food options within the educational settings, restrictions on the marketing of high sugar products to children, and the implementation of taxes on sugar-sweetened beverages have been consistently associated with significant reductions in the incidence of dental caries among children. Comparative statistical analysis were given by official data from World Health Organization, Eurostat, and national reports on caries indication and sugar consumptions. Documentary research, analysis of public policies on nutrition and oral health in 5 to 7 European Union member states, and secondary data, interviews given by study of program implementation in schools based on expert perspective from 3 to 4 countries. Results in discussion. Sweden, which has implemented advanced nutritional education programs and strict sugar-related policies, reports the lowest caries prevalence. In contrast, Romania and Poland, characterized by significantly higher sugar consumption and more fragmented public health policies, show caries rates near twice as high as those in Sweden. The prevalence of dental caries among children is in the selected European Union countries is presenting statistically revealing a clear trend. With lower daily sugar consumption exhibit both reduced caries prevalence and lower DMFT indices. Sweden, which has implemented advanced nutritional education programs and strict sugar-related policies, reports the lowest caries prevalence. Here are some examples of good practices carried out over the past 15 years. Smile for the Future campaign since 2021 under the umbrella of Colgate program. Free webinars for parents led by pediatricians have been organized by Red Cross. Education for a healthy smile in Constanța County in June 2022. Approximately 95,000 children from 12 countries participated in interactive educational workshops. The activities were organized by the Romanian Red Cross with the support of Colgate. Toothbrushes, toothpaste, and educational materials were distributed to both children and parents. Shining Smile, Education for Healthy Teeth campaign, Constanța County in 2024, supported by a cultural association and the College of Dentists in Romania, in 12 rural and urban localities, which included puppet theater performances and educational seasons with dentists. Over 2,500 children and 3,000 parents and teachers participated. Bucharest School Dental Clinic Network, managed by Administration of Hospitals and Medical Services of Bucharest. This initiative provides free annual consultation and treatments in schools and high schools in Bucharest. The network consists of 144 school dental offices, serving approximately 250,000 students with dedicated medical staff. Sweden is considered a model in caries prevention with a system based on the following pillars: nutritional education integrated into the school curriculum, national programs such as Dare to Say No to Sugar, which promote reduction of sugar consumption, free dental checkups for all children under 18, and the active involvement of local authorities monitoring oral health. France combines education, regulation, and fiscal measures through multi-sectoral intervention and strict regulations, including mandatory nutrition education in schools, a sugar-sweetened beverage tax, reinvesting into health education, and a ban on the sale of sweets and soft drinks within public schools. The impact has been notable with the DMFT index below 1.5 and reduction in the consumption of sugary drinks among students. The common elements of these best practices: public policies on nutrition and oral health influences the level of dental health among minors. Romania needs nutritional section education in schools, smart fiscal policies, equitable access to free dental services, and the active involvement of local authorities. Thank you.
Thank you too for this presentation, and this is the last presentation. Thank you very much for your attention. If it's possible, we begin to take a